in dentistry and also in oral health, most people know that most individuals have 32 teeth, plus or minus, right? But today we're going to have 32 questions. 32 questions. This is in our video episode where we talk and ask questions that highlight different dental specialties and also dental disciplines within the profession, so that you all can gain some additional insight as to life as a practicing dentist, or a healthcare professional, maybe a resident in training, but also as a dentist here in the U.S. So we're going to ask some questions and you're going to listen. First question: what's your name and where are you from?
My name is Dr. Julia Jackson. I am from Philadelphia, born and raised.
Philly, represent the city of brotherly love and
Absolutely.
sisterly. What was it? Sisterly affection.
That's right.
There we go.
215.
There you go. Or 267.
If late.
267. Yeah,
Yes,
as
but
of late. That's
215.
right.
Mm-hmm.
Yes. So what's your specialty in dentistry?
I'm an oral and maxillofacial surgeon, the pinnacle of dentistry.
And how long have you been providing care as an oral surgeon?
I finished my residency in 2011, so I've been providing care for over a decade.
Yeah. And where did you go undergrad? And what was your major in undergrad?
So, being born and raised in Philadelphia, I went to high school in Philadelphia. I went to middle school in Philadelphia. I have a younger brother who's from Philadelphia. And my mom and I did all the college tours. We went to different universities and figured out that it would be best for me to be in a university that was small so that it could be a nurturing environment. I ended up picking Wesleyan University, which is in Middletown, Connecticut, a small liberal arts college. Sometimes they're called a little Ivy or a small Ivy League institution. And I was a psychology major, and I think it was one of the best moves to get me into the open mind of education.
Yeah, and the open mind of people that we serve as well, right? How they make
Absolutely.
decisions, what they're thinking about, all
Absolutely.
very
It,
helpful in understanding and learning that.
Absolutely. I think an educational institution just kind of gives you the structure and the boundaries of where you feel comfortable, and sometimes opening your boundaries and figuring out, hey, maybe I came in to be a doctor, maybe I came in to take the pre-med prerequisites, but I'm not going to limit myself. I'm going to take psychology, I'm going to take sculpture, I'm going to take architecture, I'm going to take different courses to open my mind, still being in the confines of a educational environment. Yeah,
Now,
college is the best.
now educationally, where'd you go to dental school? Where'd you finish up at dental school?
So after being in college for 4 years, I was at a crossroads. My father had made this suggestion to my younger brother to pursue dentistry. And my mom had encouraged me that with my bachelor's in psychology, I'd need to go on for a master's or a PhD. So the crossroads were either a master's and PhD, which sounded like a long road, or perhaps to investigate dentistry. And so sure enough, I took the DAT. I remember having someone drive me from Middletown, Connecticut to New Haven, and I would take preparatory classes for the DAT, and then he would drive me back to college, and I would kind of study more and more and more, and I excelled with the DAT. And then I did get into the master's program, so still the crossroads was there. But when I found out that I was accepted to Temple University School of Dentistry in 2001, I went full steam ahead. Class of '01 undergrad, starting new class of 2001 for Temple University. And it was really that's when the road got hard,
Oh
very
yeah.
challenging. Yeah.
Oh yeah. Yeah, for uh the D in dental school stands for do it again.
it,
And do
it
it
was
again and do it
it was
again, right?
yes, yes, yeah,
Now,
trial by error. And I mean, coming from such a nurturing environment and being squeezed into this very vigorous and very strenuous and extremely intense academic challenge where they were trying to make you fail. They were trying to get you to leave. They wanted you to quit. I thought they wanted the students to stay, but they were trying to eliminate us one at a time. They'd say, look to your right, look to your left. Those two people won't be there. And that was the beginning of my opening my eyes to see that dental school was horrible experience. And quite frankly, anyone in it, if they need encouragement, if they need some point of reference, call me, because I tell you, it couldn't get any worse than dental school.
Well, the other D and for dental school also stands for DAYUM. Damn, why is dental school so hard like this? Why are y'all trying to kill us like that?
Yeah,
so
absolutely.
It sounds like one of your answers just made me think of the next question related to what was the least part of dental school, least favorite part about dental school for you?
Really, I felt so alone, so isolated. I remember that in the first year of dental school, I wanted to be more social and interactive. So we were running for class president, and I thought, well, I won't be class president because I'd been class president from high school and undergrad. So I said, I want to run for class vice president, but it was me and two guys. So I had to figure out a way to win because no one really knew me. Everyone was new, but they seemed to have more clicks already. Make a long story short, I ran and became the vice president of my class. I thought that would be okay. I thought that would be like a badge of honor. Hey, I'm smart, I can do this. It still drew me into a very lonely and a very isolated environment. There was no one to really call on. There was this group called the I'm gonna forget. It could have been like SNDA, Student National Dental Association. It was a group of people of color, and we were supposed to make that our foundation. Still a little stretch for me. I found some colleagues and some camaraderie, but I still feel like dental school was very isolating. I tried to run again for a second year, and they knew my tricks by then. I didn't make it, but I was the secretary of the Oral Maxillofacial Surgery Honor Society.
And rightfully so, because that was part of your process and pathway.
Absolutely.
So let's flip it. What was the most favorite part or the thing that you liked about dental school?
The second I took out the first tooth. Absolutely, Dr. Darwin. Oh my goodness. If there was ever a doubt, the first year, the second year, miserable, feeling gaunt, feeling weak, feeling thin, not eating well, depressed. I think I was depressed. I could have been psychologically depressed. I was totally in a bad frame of mind. The academics were hard. We were not sleeping. And then they said, okay, third year, we're going to have clinic. I'm like, oh, what's this about? And they walked me into the oral surgery department, and they showed me all the tools, the instruments, the things that we were going to use with our hands, and how we were supposed to get this tooth out. And the person was sitting in the chair, and they're nervous that they don't want a tooth out. They're scared. But I tell you, I remember it was like it's either 5 or 12 top premolar. And I had to tip him back because proper positioning for a maxillary tooth, which I always stress to the students, is the patient needs to be completely back. You cannot have them upright. You have to lay them back when we're taking out a maxillary tooth, have the patient put their chin all the way up in the air, like they're smelling the roses. And I'm holding on to this tooth with a universal forceps, 150, because I take all teeth out with 150. And I'm moving right to left. It's a palatal buckle. And I took that tooth right out. And that was the moment I knew that's it. This is it.
Yeah.
I'm doing this every day. It was
Yeah.
almost like I saw colors and rainbows. I felt like this was the moment I was waiting for. He closed his mouth. I had put a little bandage in. He closed his mouth. He was comfortable and at ease. And I just knew that this was it. This was the plan. This was why I went through all these hassles before I got here.
Right.
It was perfect.
Perfect.
Absolutely perfect.
Yeah, DrDarwin, just want to take a quick break from this episode and hope that you are enjoying it. First thing I want to ask is, did you know that a large majority of the individuals like you who watch these episodes are not subscribed to the channel, to the YouTube channel? Nevertheless, we want to say thank you for watching and continuing to share these videos and episodes with others. Next, I want to say is subscribe. Yes, please hit the subscribe button so that you get these notifications each time these episodes are released. Last is I wanted to connect with those of you who are seeking to become an advanced dentist and specialist. And I invite you to our next event called the Get Into Dental Residency Challenge. This is a special 4-day event that will give you direct access to the mistakes that you want to avoid when you're applying to residency programs, and also the 8 steps that you also want to avoid so that you do not have an unsuccessful application submission. The information that we will be covering over those 4 days will be some of the tips and strategies that I teach in my one-on-one and group coaching trainings with clients who are continually and successfully being matched into and selected into high-profile residency programs here in North America. So if you're pursuing or aspiring to get into dental residency this application cycle, this challenge is for you. Check out the link below to receive more details and join the challenge. And also, I would encourage you to enroll in the challenge via the VIP experience. The VIP experience gives you actually access to a 1-hour Q&A session every day of the challenge before we actually get started with the challenge. And it guarantees me to answer your specific questions that you and other VIP experience members have on a daily basis. So I'll see you in the Get Into Dental Residency Challenge, and let's get back to this episode. It just takes one experience, right? Just
That's
one
it.
experience. So you probably had some experience about some tough things too. What was the hardest part about dental school for you, and how did you overcome it? What was the hardest part of dental school for you?
Different courses, everything had its own challenge. Histology was very difficult. Some of the sciences were a little more challenging than I'd ever expected or experienced. Organic chemistry was, no joke, as they say. The academics were the rigors for me. They were the hardest part. Meanwhile, I would spend nights in the lab festooning and waxing and carving, and you put a little music on and we could be in there and make dentures for days. I just really enjoyed the technical part, the manual dexterity. I really flourished with making things and creating things with my hands. One of the things about Temple is we had to spin our own gold crowns. I made a gold crown. I gave it to my dad. So the hard parts were the studies. I did it. The easy parts were the working with my hands.
Yeah. So on the first day of dental school, and if you remember this, I can't remember the first day because I was traumatized, so I don't remember all of it. But on the first day of dental school, did you have an idea about a specialty that you thought that maybe you wanted to explore before it eventually came to be oral surgery? Was there another specialty or something that you were thinking about?
There was never anything that caught my eye. The answer is no. I wanted to be an oral surgeon. I don't know if it was the experience in 3rd year or the kind of knowing that my dad had a very good friend, best friend, who was a Kappa like my father. They played tennis together. Dr. Franklin Scott, excellent mentor, lives in Philadelphia, and he is an oral and maxillofacial surgeon. And so he kind of put in my head, okay, well, you got to get through dental school first, and then we'll see what's the next step. So I'm destined to become an oral and maxillofacial surgeon. That was it. I'm going in that direction, and no, I'm not turning. I was never interested in cleaning teeth, fixing teeth. Absolutely not. No. And I would not have taken one of those like GPR clears, like let's just do a little general dentistry. Nah, no GPR, no AEGD, none of it. It was only oral surgery. And I think that's really how you have to be when your goal is to become an oral surgeon. It's blinders, like the horses that run the carriages. They can't be distracted by the traffic. You have to put the blinders on. And now my blinders are on so seriously that sometimes I don't see the other parts, and I'm focused, because that's how I've been trained to be. And you have to do that if that's where you're trying to go. You can't be lollygagging and figuring this out. And what about if I get married, and when am I going to have kids? It's like laser focused. Like the guy who plays on the quarterback, help me here, Dr. Darwin. He's Tom Brady. Is he the quarterback for the Patriots? Right. Mm-hmm. His shot is on point. You throwing it on, he can throw the football at the target and not miss it. That's how precision it is. Yeah. That's why we watch the Olympics, because we know how much it takes for them to train. That's what it took to become an oral and maxillofacial surgeon.
It's no joke. So absolutely. Third year is when you realized it. Now, before third year, did you have any exposure to any other specialties to the point where you're like, oh no, I definitely don't want to do this specialty?
No, I had braces when I was a kid, so I didn't have any problem with orthodontics. I was not upset with anything.
Yeah, well, that's cool, because sometimes some people, they'll go into beginning dental school, and you guys who are listening, guys and gals who are listening, you guys will go into dental school with an idea of like, okay, I want to check out oral surgery, I want to check out ortho, and I don't want to check out pedo. But then things change as you go through the second year, maybe even the third year. Some things that you like or don't like. So it's always interesting to see how your focus and how you got your focus based on your pathway as well. So let's talk about the second quadrant of questions that we have is based on oral surgery. So what about oral surgery made you fall in love with it?
I just think of it like a challenge that I was able to conquer. Almost like when you have some kind of project that you want to see come to completion. I just had a great joy and love for finishing what I started. And I see that in oral surgery. I see outcomes with oral surgery. The other parts about oral surgery that were fascinating included the trauma when we would see someone who was badly injured. This kind of leads into more complex residency. This wasn't just at dental school. So in dental school, it was the tools that captivated me first, and then the experience of being able to take the tooth out, and that being an accomplishment that I can walk away from and say, I did a good job. It's like a short-term relationship. I may never see that person again. I didn't need to be the kind of dentist who was going to have these 6-month recalls and continually having conversation with the same person. This is a wham bam, we're done. You only have one tooth that needs to go. That's it. Sometimes we would take out 4 wisdom teeth. Okay. But the idea was it was a short-term relationship. So that was those were some of the things that I liked about oral surgery early. Tools, non-committed relationships, and also the feeling of accomplishment. Then I got into residency, and it was like, wow, it gets better. It only gets better.
Yeah. Well, let's talk about the residency training. How long is typically the training to become an oral surgery or an oral surgeon, including if there's the 2 different pathways and the possibility of doing like some fellowships or any type of special research? Talk to us about that.
So I will just say this, it's not just 2 pathways. I think that any listener there needs to realize that their pathway certainly won't be mine. And if I could just make a suggestion, don't take a shortcut. And number two, sometimes you want to take the path that's least traveled by. So there's not just one pathway. It's not just, okay, you can take a 4-year program and become an oral surgeon. It's not, oh, take the 6-year program and now you'll get an MD and become an oral surgeon. As a matter of fact, I ended up doing 6 years and including 2 internship years and then becoming an oral surgeon. So find the path, ask a friend, and only ask people who've been down the path. Be sure you check your resources. If you're asking an endodontist, how do you get into oral surgery? You're not talking the same language. Find an oral surgeon. There's not that many of us. I'm here. I volunteer to talk to any student who has any question about the motivation that it takes to become an oral and maxillofacial surgeon. But my path was, when I finished dental school, I wasn't ready for a 4-year program yet. I wasn't exactly ready for the commitment. So I looked into it and I found out that oral surgery programs have, forget what it's called, but they'll have a 4-year program and then they'll have like this other year where you can be an intern and you can follow the residents and do everything that they do. So an intern.
Yeah, what you're talking about is an oral, it's an oral surgery internship. Yep.
Exactly. So I got into one in Brooklyn, New York, year 2005. And I was the intern. They used to call us a scut monkey. It's not derogatory. It's the monkey is more like you're jumping around, you're doing everything, you're running here, you're running there.
Yes.
Scut is the work, which is get the x-rays, take the health and physical, make sure you get the room ready, make sure you have all the instruments. And it was all hours of the day, all hours of the night. So I did that for 1 year. And then to make a long story short, my program, it was myself and another female, and they chose her. And she politely laughed in their face and said, I would never work for you because of the way you treated us. And I said, Anne, what do you mean? She said, never, I would never do that. I said, okay. So I said to them, can I have her position? And they said, no, but we'll give you a second 1 year. And I said, okay, no problem. So Anne is not an oral surgeon today because you can't look a gift horse in the mouth. If someone offers you water, just take the water. You can go decide that you want sparkling water later. Take the water. So I got into the second year. Now the second year, again, I'm working, scut monkey, everything, all hours of the day, everything. Now this time it's myself and a male. And I do believe they picked him. They did not pick me. But that time I also learned that I needed to apply to more programs. The first time I only applied to 7. The second time I applied to 25. I had some interviews. I thought I was going out to California to a place called King Drew University. They did not pick me for match because King Drew's program started to fall apart, and the dean called me and said, well, we wanted you to get into some program and then make the choice of if you wanted to leave the program you got into and come to ours. But he said, you should go to the program that picked you, and Howard University picked me. So this was my, shout out
to HU. HU also shout out to King Drew.
And I love when the patients ask me, they say, well, what university did you graduate from? And I say, well, which university? Because HU was one of them. Absolutely. Howard University gave me my start.
Temple, Howard.
Yes.
All
Howard University, yes, it gave me my start. It was a 4-year program after the 2 1-year programs. So my path ended up being 6 years, which probably would have been less than if I had, more than if I had taken the master's and the PhD that route long ago. But getting into Howard University and finishing in class of 2011, There was only 3 people in my class, myself and one other guy. One of the guys in our program quit. He decided he didn't want to graduate from Howard. He wanted to graduate from Pitt. And he's not an oral surgeon either. Again, don't say no to what's being offered to you. He was in our program. He could have finished like we did. He decided he wanted to leave. They took him back a year, told him that he wasn't a second year. Now he needed to start first year over. Whole bunch of nonsense. So they brought in another guy from a year behind us and brought him into our year. And the 3 of us, my colleague, Dr. Robert Days, and myself, and another guy, John Jamil Royer, we're all graduated 2011, HU, and very happy since then.
Yeah, shout out to HU. We've got a couple of episodes, oral surgery episodes. Watch this one right up here with Dr. Akinozi, who just finished. He was chief resident, just finished last year. And here's another one right here.
Okay.
Of a couple of residents that are at Howard right now. So what do you, as an oral surgeon, what do you think is the most unique part about your specialty? What makes oral surgery so unique in your opinion?
Oral and maxillofacial surgery is the pinnacle of dentistry. We help patients from the cranium to the clavicles. So we are all inclusive. We're helping with trauma. We're helping with aesthetics, moving the jaw in different positions with orthodontic procedures. We're helping with pathology. If there's a head and neck cancer, we're doing major flaps. We're doing blepharoplasty, some cosmetic procedures. We're doing your regular dental alveolar procedures, smoothing down bone, taking out teeth. We're the only ones who actually put patients to sleep while we're doing our procedures. So we have anesthesia component to our training. Oral and maxillofacial surgery is all inclusive. And it really is, it's its own world. I don't know how to better explain it. I don't even know what to say.
No, you said I like the cranium to clavicle. I'm gonna use that.
Absolutely.
I'm gonna use that.
Absolutely.
And it's all of that too, right?
Absolutely.
All the cranial nerves that originate originate from up top and go throughout the whole body,
Absolutely.
from the head. And again, another reason why it's so important that oral health is integrated into overall health, because last time I checked, I think you too, Doc, the head is part of the body. They're connected.
Absolutely. Absolutely.
Right?
And I think of pinnacle of dentistry like a pyramid. The base is general dentistry. We can't do it without general dentistry. We can't do it without GPs. They're the front line. They're the ones who find the problems. They're the ones who see the people. They're the ones who talk to the public. They're the ones who talk about oral health. They're the ones who motivate and educate. Yeah. And then I think of it kind of like football. If a GP has something that they can't manage, okay, they're the coach. They'll send out the teams. Well, sometimes we need to send in a special team. We need an endodontist, do a root canal. We need a periodontist who can check the status of the gingiva and the periodontium. But as things get up and moving up their pyramid and getting to the pinnacle of dentistry, in my opinion, it's oral and maxillofacial surgery. Because once we take the tooth out, that's the end. It's a wrap. Now we need to be talking about, even before we took it out, how we're going to replace it. Bone grafts, membranes, sinus lifts, extra ways of making this aesthetically pleasing. So oral and maxillofacial surgery has always and will always be the pinnacle of dentistry.
Yeah, and that's key for people to understand if they want to be, part of that pinnacle of dentistry. So why should someone consider oral surgery?
Because there's nothing better.
Why should they?
There's nothing better. I'll tell you this. So in my travels, in my journey, I don't exactly remember when it was. I think it was in dental school. I went on a trip to Bahamas, something like that, maybe Bermuda. And I had a clever idea. I said, I'm going to go to the dentist and see if I can, when I finish my dental school training, if I can come here and just take teeth out. Because all my passion is to remove teeth. I don't know if I expressed that. My name is Dr. Jackson. They call me Extraction Jackson. I take teeth out. I took out more teeth in my entire dental school year that I was there. I like to take the teeth out. I feel that being that specific challenge is something that makes me feel good to help others, because not everyone can take teeth out. So I went to this dentist in Bermuda and I'm asking, can I come and work here? I will be finished my dental school program. I just want to take the teeth out. And I got pushback. I thought, wait, it's another country. They don't care. But no, they said, no, if you're coming, you need to be an oral surgeon. So if you want to be doing oral surgery and you love the oral surgery procedures, you have to be an oral surgeon. So when you ask me, why does someone want to be an oral surgeon? It depends on your passion. Now, don't get me wrong.
Yeah. These
days, I am teaching general dentists how to do oral surgery procedures, because if I wasn't as lucky as I am, and I wasn't as blessed as I am, and perhaps as brilliant as I use my mind to work and figure and solve problems, if I didn't have that and I was a general dentist, then I would want to be doing oral surgery. So I feel these days, leave specialties for specialists, but putting an implant in is not that special. If I can teach a general dentist how to replace a tooth that they just removed, well, then by all means, send the harder concepts to me, something that a tooth you can't find in the palate, no problem, I'll take care of it. But if there's a tooth that you can take out, then I want to encourage general dentists how to do atraumatic extractions. Yeah. I want to encourage general dentists how to put in implants. So you ask, why would someone want to be an oral surgeon? Well, in this day and age, it helps to be an oral surgeon if you're doing more complex oral surgery cases. But as an oral surgeon, I will also help a general dentist learn how to do some of the more routine oral surgery procedures.
So let's flip it then. So
yes, sir.
Why should someone not choose oral surgery outside of not wanting to take teeth out, right? What are some other reasons why you should not, or a person should not choose oral surgery?
There's no reason not to choose oral surgery. I can't come up with anything.
Well, I would say in that case there would be no endodontist, no pediatric dentist.
Right. Everyone should be an oral surgeon. Absolutely.
But why should someone not choose? Who is oral surgery not for, basically? Who is oral surgery not for?
I don't know, Dr. Darwin. I don't know who oral surgery is not for. There's a part of oral surgery in everyone. Every general dentist, endodontist, periodontist, pediatric dentist, there's oral surgery that trickles through all of them. And they just need to kind of cultivate their interest. If they have different interests, no problem. But everyone has a bit of oral surgery love. They have to. I can't see it any other way.
Well, you're speaking from an oral surgeon perspective.
Exactly.
So keep in mind, we've got people that are listening and watching, trying to figure out, I want to specialize. I'm just still learning about all the different specialties, right? Trying to figure these things out.
Yes.
And there's some advantages and disadvantages with all the specialties based on procedures, based on lifestyle, based on what you're looking for, etc. Based on what you know about oral surgery, you being Extraction Jackson and knowing all the expertise and the inner workings of the specialty, what do you think is the things that people should know when they're exploring the specialties, specifically oral surgery? What are the things that they should know that this is A, B, and C is about oral surgery? And if you don't like A, B, and C, then it's not for you. What's A, B, and C?
Okay. So A is you have to be prepared. Oral and maxillofacial surgeons have a ridiculous ego. So they're going to stomp on you and make you feel small. So A is be careful of their ego. B is you need to work on your confidence because nobody's going to stomp on you. And if they do, take it, walk away, handle it, and come back for more, because that's what it takes. So C would be perseverance. You cannot be easily swayed by your goals. Perseverance is going to get you to be able to step up to these challenges. So the A is their egos. Oral and maxillofacial surgeons may not make you feel very warm and comforting. For instance, I've asked others, when you went to the oral surgery clinic, did they say, come on in? Did they say, hey, take out some more teeth? Hey, we want you to try third molars? They're not really warm and fuzzy folks. They're not the ones who say, hey, we have an implant in dental school. Why don't we let the dental students put the implants in? They're going to say, no, we're going to keep that for perio department, or keep that. So they're not welcoming. Get past that. Not every door has a welcome sign on it. Move forward and get into the oral surgery clinic. Number two, you need to have confidence, because they're going to see that you may not seem like the person who should be taking the teeth out. I distinctly remember being in Temple University School of Dentistry with a female oral surgeon who told me that I didn't seem like I was the type of person to be an oral surgeon. How is that supposed to make me feel? Like, am I supposed to think to myself,
you don't
okay,
know
well,
me. You don't know me.
Right. It reminds me of the reviews on Google, right? Because the Google reviews these days in 2025, these folks will write anything they want about you. They don't know you at all, but you have provided a service. And more importantly, you got the tooth out. So why are we this lady in dental school told me that she didn't think that I was oral surgery like caliber or capable. Don't sweat the small stuff. Don't listen to the naysayers. That's the number. That's the B. And then the C was perseverance, because there's going to be these major obstacles in your path. Someone will tell you, oh, it's going to take 6 years or more. Or, oh, you'll never get married. Or, oh, when are you going to have a family? Or, oh, this is so much, so much debt. So much, you're not making any money, right? Yeah. You're not making any money. You have to persevere. And I'm going to put, I guess, D or C/ is stick-to-itiveness. You must. Grit.
If you ain't got grit, if you don't have grit and the ability to grind, forget about it, especially for oral surgery. If you lack confidence and don't have tough skin or can't develop tough skin, forget about oral surgery. If you're unable to accept criticism to the point where you're not taking it personal, but if you do take it personal, you can't circumvent around that, do not consider oral surgery, right? If you're unable to persevere and, like I said, grind it out and continue to work hard, even though it appears that there's no end in mind, do not consider oral surgery. So that's a good perspective, so people can have a better idea, because all of those things are characteristics that you need to have through this process, not only of choosing, but knowing what you're choosing and what you're getting into. You mentioned ego. Is that a stereotype? Is that a stereotype of oral surgery?
That would have been one of my things to say as a stereotype of oral surgeon.
Are there any other ones? And are they true?
Well, I just said egocentric, slightly narcissistic.
Yep, we got that one on the list. Any other ones?
But so maybe egocentric and not patient centric. So they'll come in and they'll be talking about the surgery and forget that you need to remember that the tooth is attached to the person. And so I guess that's what I do differently.
It's the patient's tooth, not your tooth, even though you got it in your hand and your forceps.
Right.
It's still it was the patient's tooth. It came from the patient.
Correct.
Gotcha. Gotcha. All right, so let's pivot to our third quadrant of questions here related to typical day. So what's a typical day for a private practice oral surgeon? Maybe not, that's not in academia, maybe one that's not associated or has a part-time faculty position at a hospital or attending position at a hospital, just true blue private practice, which a lot of oral surgeons probably fit that category more so than hospital-based. Still some in academia, of course, but it seems to be a lot more in private practice. Just from that perspective, what's a typical or an average day look like for you as an oral surgeon, clinical based?
That's part of oral surgery, is that you get to make up your own schedule. You get to decide how you want your practice to be run. There are oral surgeons whose regular activities are TMJ consultations. And then once you have consulted on the TMJ, is it palliative care? Is it going to be something more extensive? Does it require some kind of arthrocentesis? Do you need to take the patient to the hospital? So there are oral surgeons who kind of run the gambit of, well, is it just going to be something I can do in my office, which is our bread and butter, dental alveolar, including reduction of tori, extraction of teeth, malpositioned teeth, impacted teeth, non-restorable teeth. So once we've discussed taking the tooth out, well, then now we're talking about bone grafting, membranes, implants. So I really do believe it depends on the oral surgeon. What is your interest? There's some oral surgeons who do evaluation for cosmetic procedures in the office and then take the patient to the OR, blepharoplasty, eye lifts, all kinds of rhinoplasty. There are oral surgeons who manage cleft lip, cleft palate, which is much more of a rigorous in-hospital based practice. So it really depends on what it is that the oral surgeon is looking for. Like I said, mine is really, I just wanted to take teeth out. So I don't have to be in the OR to do that. There was a point in time when I had OR privileges in 5 hospitals for a variety of reasons. One of the hospitals was so that I could work closely with the residents and show them how to take teeth out. One of the hospitals was so that I could take my patients to that hospital because it was close to my practice. One of the hospitals was just simply so that I could be on what we call grand rounds and talk to the students about the patients, be involved with the grand rounds of the hospital stay of the patients, trauma patients. So there are a variety of ways, and that's part of oral surgery, that you can dictate your day-to-day activity. If you get into your office at 9 o'clock in the morning, maybe 8:30, and you have one side of the schedule is 8 patients that you're going to take wisdom teeth out, you should be able to take 4 wisdom teeth out in no more than 20 minutes. That includes from start to finish, extractions, or waking the patient up, suturing the area. I suture the area when the person is awake so that we're not utilizing excessive sedation. And then once you get them into recovery, you're back and taking out teeth for the next person. So it's back to back to back. Maybe afternoon is follow-ups, perhaps afternoon is consults. There may be a case in there of tori reduction. My favorite is tori reduction, especially large tori on the mandible, palatal tori. We need a suck down to cover and protect the wound after the procedure. So it really depends on the oral surgeon. My schedule might even be different than my colleague. Maybe he's doing all on 4 that morning, and in the afternoon he took off. So it's a variety is the spice of life. It depends on what you choose. Mm-hmm.
So you talked about different procedures, tori removal, wisdom teeth, of course, maybe even having to go to the OR to do some bilateral reductions or what is it? BBS.
Yes.
Oh,
yes.
Lord.
That's orthodontic procedures.
Orthodontic procedures. Is that one of the procedures that's been the hardest or most challenging that you've completed? What's been the most hardest or the toughest, most challenging procedure that you've worked on?
The first tooth I took out in dental school was the hardest one. Just walking into the room, and the one that I remember the most is walking into the room. This was this premolar on the top, tipping him back. So
yeah, but you were a dental student. You weren't an oral surgeon.
No,
we want to hear about the oral surgery ones.
I was in the oral surgery department. So I mean, that was the beginning, the bud of me, and my passion for oral surgery was in the dental school oral surgery clinic. I cannot think of anything that was too much of a challenge. I pride myself in saying I haven't had a tooth beat me yet. There hasn't been a tooth that I haven't been able to remove. There have been some especially tricky ones. Sometimes we have to take out a tooth at the inferior border of the mandible, coming in from the lingual, trying to retract all the soft tissue, get down, way down into the space. If you do end up making it a coronectomy where you just remove the crown and then you could jimmy up the root from the inferior border. I mean, it's not tricky, but maybe there's perspiration and you're thinking, my God, is this going to be over? But you get the tooth out.
But the first time you did it,
I've always gotten the tooth out.
Not that you didn't get it out, but I'm sure it was, if it was the first time you were doing something as a resident, granted, you observed, you assisted the second years, the third years, the fourth years.
Right. Well,
I'm sure there was one.
Maybe trying to reconstruct a mandible. We have what we call favorable and non-favorable fractures. Like when the muscles are pulling the break apart is a non-favorable fracture versus if the muscles are kind of helping to keep the crack or the fracture together. I've seen other people's challenges. I've witnessed one time in residency, I remember we all were in the room. We did a whole case. It was very exciting. It was an orthodontic procedure. We took the patient out of the room. Anesthesia was there. Everyone was patting the chief resident on the back. We got to recovery and the patient started coughing and coughing and coughing. And we looked and coughing and they had left the throat pack in the throat. And the person wasn't breathing. I mean, I just remember challenges that weren't necessarily my own, but challenges that I will never forget. That person's okay. You know, you're always mindful of a throat back check because remember, this person shut down with wires. You can't have them shut down with wires and the throat pack behind the shutdown. So
somebody missed a step on the checklist.
Maybe, right. But I can't. There's nothing that I can think of.
You just named two though. That was good.
Okay.
Because those lingual version extractions that are partially or completely impacted that innervate or touch near.
Yes.
And
the inferior border of the arm. Yes. It's the ones that my assistants say to me, Dr. Jackson, why are you taking this tooth out? Like, it's the ones where other people are like, well, why are you doing this? This is entirely too difficult. And I say to them, that's why they sent them to us. So
you should have told them, as an oral surgeon, I am the alpha and the omega. Exactly. I am the beginning.
Exactly.
I'm the expert in the beginning and the expert at the end. As in, I get the referral at the beginning and I get it at the end when there's a problem.
Oh, exactly. But see, that's the ego there. It just blows it right up. Like, I can do anything.
Right. Would you say that third molar extractions is probably the most common procedure that most oral surgeons will do? Or is it something else?
Yeah, third molar, or just taking out a tooth that can't be fixed. Because we take out teeth. So if you think about it, third molars are going to be predominantly like 16, 17. I mean, I take out third molars on 22-year-olds, but there's a whole plethora of middle-aged people who need a single tooth removed. So it depends on the practice, to be quite frank, Dr. Darwin. It could be third molars, but I'll just say simply extractions are the most common procedures that oral surgeon would do. Depending on the oral surgeon. There's probably an oral surgeon who repairs cleft lips and hasn't taken a tooth out in 15 days or 15 years, you know? So it would depend
because they
on
specialize within the specialty.
Absolutely. I don't treat TMJ.
Niche.
So maybe you're speaking to another oral surgeon who says, oh yeah, this is my bread and butter, TMJ. I personally do not treat TMJ for my own reasons.
Yeah. So cases, since we're to start talking about cases, give us an example of one of your most memorable cases or procedures that you did that gave you like exhilarating feelings as an oral surgeon.
I believe that feeling is not just my own egocentric, happiness. It is when the patients are happy. It's the patient's response is what gives you the most joy. I had a patient who came in and she sat down. This was after the procedure, probably like a month or two after the procedure. And she had a bottle of Dom Perignon. And I was like, what's this for? You already paid for the procedure. We don't have to. She said, nope, I want to give you this because you have changed my life. There was a point when I was wearing an upper denture and I couldn't appreciate the bubbles of the champagne on the roof of my mouth. And now I want you to be able to appreciate it as much as I do. Here. I said, oh,
Cheers. Cheers.
Exactly.
Cheers.
Exactly.
Cheers,
So,
Miss Jones. Cheers, Miss Jones.
So this was an all-on-4 upper. And when we do an all-on-4 upper, the palatal portion of the denture is removed and reduced.
Yes, hallelujah, hallelujah, hallelujah.
And they don't have to wear this bulky denture that's moving around anymore. So
right.
I mean, those are the things.
Yeah, those are life-changing.
Yeah.
Because the first thing that you see too on their face is this.
Yes. Patient satisfaction.
Smiling. Yeah, they start smiling like from ear to ear, neck to neck. Like
absolutely.
It's
just
amazing.
Making other people smile. Now, because in oral maxillofacial surgery, my job is to make sure that the foundation is solid. So I don't ever really get to see the smiley, happy folks because they got a crown from DrDarwin's office or they got a crown from the general dentist. And I never really see the follow-up. So when someone does come back a couple months later or something or says, hey, look at this now. Or they go for a job interview. I did anterior maxillary implants and the guy felt like he got the job because he had new teeth. Those kinds of rewards. When I go out to Arizona, we work with a methamphetamine clinic.
Oh, okay.
And when they're on this clinic, the idea is that you don't want to just rehab the person's mind and get them off of drugs. You want to rehab their mouth so that they can start to feel more involved with the rehab. And so those folks have beautiful smiles when we're done and feel just the feeling of accomplishment again, of making someone else happy.
Yeah. In one sentence, what is the toughest part about your role in position as a oral maxillofacial surgeon?
Toughest part? Well, we are problem solvers. Sometimes you just have to think a little bit longer about the problem. I think one of your questions here was about how much sleep do you get? I don't sleep a lot.
Well, we haven't got to those yet. We haven't got to the fun part
yet.
No. But the toughest, what's been the toughest part about being an oral surgeon for you? What's been the toughest part about being an oral surgeon?
Dr. Darwin, you got me thinking again. I don't know.
All right, well, we can come back to it.
About it.
Come back to it. I got another part that I want you to think about, which is the most rewarding part about being an oral surgeon. What's been the most rewarding part outside of that case where Miss Jones came and brought you some Dom Perignon? What's been the overall, would you say, what's been the most rewarding part about being an oral surgeon?
I'm just glad that I got to the finish line. The reward is the degree to be an oral and maxillofacial surgeon. The reward is to be able to treat patients in oral surgery daily. The reward is to be an oral surgeon. That was the award, was to finish what we started and to get to a completion. And now to say oral and maxillofacial surgeons, I'm the only oral and maxillofacial surgeon that's an African-American female in the Commonwealth of Virginia. I'm the only African-American female oral surgeon when I was in the Commonwealth of Pennsylvania. I mean, there's not that many of us. And
now,
then I
guess mean license or board certified, or what's the
practicing
distinction?
Period.
Practicing.
Yeah. There's no other African-American female oral surgeon that's practicing in the Commonwealth of Virginia, period.
Well,
And
that,
in the Commonwealth of Pennsylvania.
well, Dr. Jackson and I get ready to make that change.
Exactly. I'm ready,
make those
ladies.
statistics change.
I'm
All right.
step up to
So,
the plate,
ladies, as you are
Exactly.
considering your careers in dentistry, as you are
Exactly.
embarking on going into dental school, starting dental school, if you're looking for specialties to explore,
Exactly.
this may be one for you. And this is the reason why you need to go back and listen to some of the things that we're sharing about the highlights, the lowlights, and things that are rewarding, and what a typical day and what training is like. So you have a better perspective. Let's move now to the fun stuff.
Dr. Darwin,
Yep.
I challenge any of you all to become an oral and maxillofacial surgeon and practice in the Commonwealth of Virginia. Come find me. Come find me. So
well,
I'm not.
They
so
found you today.
So I cannot continue to say that. I've been saying that since 2007. Yep. I don't want to say that anymore. It's too long.
Well, we have found you. They have found you today, and that's why this this episode all about oral maxillofacial surgery is so important. 32 questions for Dr. Action Jackson.
Thank you.
Let's move now to the fun part, and about lifestyle and fun. So we talked about sleep. How many hours? Just real quick. How many hours do you sleep per night? Or 4. Did you used to sleep? 4. Okay. How many hours do you work during the week?
40. That's a whole week, right?
Yeah. Yeah. Do you take taking call, or do you see patients after hours currently?
Yes. I was seeing patients. Let me say it differently. Taking call means that if there was a rotation, and so we would field calls for patients who were treated that week, depending on if it was myself or my colleague. And then
now, is this is this during residency or after residency?
No, private practice.
Okay.
You still have to be able to talk to someone who got their tooth removed this morning on a Monday morning. They call it, I don't know, 6:30 while you're having dinner, and they're asking you, why is it still bleeding? And you say, well, the way to stop bleeding is with pressure. You cannot talk on the phone or talk to the person next to you. You need to change your gauze, make sure that it's so bulky that you can't close your teeth together. And that way it's putting adequate pressure in the area and the wound, and just talk them through it. Let them know, okay, I'll give you a call back in 15 minutes and we can double check the bandage.
So you're still doing follow-ups, post treatment, after hours, which even if you're not an oral surgeon, guess what? You should be doing that anyway. Anyone you give anesthesia to, you should be calling, see how Mr. Hayes is or Miss Smith is, and they will be so surprised that their dentist is calling them.
Yes,
that's a whole nother discussion.
They love it. Right.
Okay, morning or night person?
That's a good one. I'll say morning.
Okay. Okay. Favorite color?
Favorite color, purple.
Good. Got a little purple for you right there. There you go.
Thank you.
Favorite food and drink?
Thai food, any day. Oh, ackee and saltfish. That's another good food.
Thai, ackee, saltfish. Okay. Favorite beverage? Pineapple, lemonade.
I always drink water. I'm a water girl. Yeah.
Now, are you a clear bottle cap water drinker? Are you blue? Are you black? Are you red? Because you know there's different types of water based on the cap. You know that, right?
Oh, this is white.
That's white. That's usually just regular spring water. Again, a whole nother conversation. But so
you're
water.
Teaching me something.
Yeah. Favorite place to visit or go on vacation?
I love the beach. We're on our way to Jamaica on the 3rd. I can't wait to put my feet in the water.
Any beach or just
any beach?
Specifically?
Aruba, Bahamas.
Okay.
I've been to all of them. And I collect little sand from them. I have little, Sorry.
Uh, favorite thing to do when you're not in the office or not practicing or not in clinic or not teaching?
I like to play tennis with my son.
Awesome. Awesome. Okay. Some bonus questions. Bonus questions. What let's see. 3 tips. Knowing what you know now, having been in oral surgery almost 15 years, an oral surgeon 15 years, and a dentist almost 20. Well, 25 if you include dental school, right? What are 3 tips that you would want to share that aspiring oral surgeons must do?
Never give up.
Mm,
Never give up.
perseverance again.
There we go. Because you will face some resistance, and your resistance will only make you more resilient. Never give up. Call me. Call me. I don't know. However, I can encourage you and tell you that this is not something that will keep you down. I'm not the smartest person in the class, but I didn't give up and I got there.
Yeah. Another tip.
Another tip.
Advice.
Don't be so hard on yourself. Gosh, it doesn't, it's not you. It's the structure of the circumstance.
But how do I mean, I think for most of us, it can be received as more easier said than done. How do you not be hard on yourself? What are some examples that maybe you've heard people say or things that they've done to kind of like get that pressure off themselves?
Yes, you should pray. Prayer works. Pray. Do not stray from prayer. Talk to the moon. Have some kind of outside experience that tells you that you can do this. Be in tune with yourself. What is it that really makes you feel good? If residency wasn't hard because I loved what we were doing, it doesn't matter how long it took if it's something that interests you on a day-to-day consistent basis. So you have to be very much in tune with what it is that's driving you. Why do you want to do this? What's your end goal? What is it that you're trying to accomplish? And if oral surgery is the path, well, then that won't be too bad because this is a nice path. But the goal is what's important. Really narrow it down, write about it, pros and cons of what your goal is. How do you want to get there? Don't take any shortcuts.
No shortcuts.
No shortcuts.
Four great tips. No shortcuts. Narrow down your goal. Make sure that you're real specific. Your goal should also be SMART. SMART. If you don't know what that is, Google it real quick. You'll find out. Don't be hard on yourself. And you said it first, and it's probably one of the most important things is don't give up. Don't ever give up.
Yeah, you can do it.
You don't have time to give up. There's too much stuff for you to do for you to be giving up. If you could change one thing about our dental profession or oral health, as an oral health leader, educator, and provider, what would it be? What would you change about dentistry?
I think that when we have a patient that comes in who knows what they want and is an educated patient and knows the difference between a root canal and a crown, I just think educated patients help society. And I do believe, although this is going to sound kind of taboo, Clear Choice and some of these DSOs are putting in a lot of patient education. And so the patients watch the videos, the patients look at the pamphlets, the patients come in knowing what All-on-4 is. It may be a colloquial expression of, well, I want 4 implants or I want 6 implants. But when a patient comes in and says, I want an implant, and they don't know that they need 6 of them versus I want an implant, and they don't have the real understanding that an implant is different than 6 implants cost-wise, procedural-wise, it kind of clouds things. I think if we could change one thing, is that people overall should be more educated in dentistry. Even in my own little world, my husband didn't know what an oral surgeon was. He was like, don't all dentists take out teeth? No, sir, not all dentists take out teeth. So, I think it should be in the high school training, in the college training. I try to go to career days and teach them what is oral and maxillofacial surgery. What does it actually mean? So an educated patient would make a world of difference in society today.
Yeah. And your point about people not knowing what dentists do, which is a whole nother conversation, but just like not all medical doctors do dermatology, not all medical doctors do internal medicine, right?
Right.
Dentistry is actually a specialty of medicine. Again, another conversation for another time as
Absolutely.
well. Well, listen, this has been very helpful. You've gone through our 4 quadrants of 32 questions.
Yay.
And there you have it, everyone. All about oral maxillofacial surgery. Doc, what's the best way for people to get in contact with you if they have some questions or just want to connect with you?
Absolutely. I've just ventured out into a new arena. I am starting an international implant institute here in Manassas, Virginia. It is called International Implant Institute. It can be found on the web at INTL Institute, INSTITUTE.com, International Implant Institute. We are providing, thank you. We are providing courses to general dentists, to dental practitioners to understand how to place implants. We're going to do all model surgery. The courses are 5 days. We have availability in September, November, and January. And what we're doing is we are providing hands-on, very warm and intimate relationships with students so that they can get comfortable with placing implants. If I can do it, you all can do it too. It's very similar to carpentry. And not only are we going to place implants, but we're going to go over socket grafting in the event that an implant can't be placed. And also we're going to talk about how to restore implants. And then lastly, everyone will receive ACLF and PLS and BLS certification if you come through the course. We recently got our certification from PACE, P-A-C-E. So we are open to all advanced general dentistry participants in the directory. So you can just find me at Extraction Jackson. Just find me at extractionjackson.com. It'll all lead to the same
There you
spot,
go.
extractionjackson.com.
There you go. Now you can get in contact with Dr. Jackson, Dr. Extraction Jackson, Julia Jackson, and get some more information about some of the services in her office, but also some of the education that's out there. And if you have questions, just more about oral surgery and becoming an oral surgeon one day. So, been very good. Now, next good thing that you can do is go to the next video. Go to the next video. There's a whole bunch of more, a lot more stuff going on over here and over there. Go to the next video. Go.
Thank you.